So now that we talked about the cardiac cycles and all the different waves and part, we're going to put it together in this rhythm analysis. I'm starting with normal sinus, sinus brady, sinus tach. But the first thing I want to talk about is how do we analyze a rhythm? There's lots of different methods, and you're going to use lots of different ones when you get into practice, but the 5-step method is a quick, easy, user-friendly tool to help you determine what a person's heart rhythm is. So I want to talk about each part of those steps. The first thing you're going to do when you're looking at a 6-second strip, and remember in this course lead 2, is you are going to determine what is the heart rate on a 6-second strip. Okay? So I'm going to show you that in just a few minutes. After you determine the heart rate, then you're going to look at the rhythm. You're going to measure to see if your R to R is regular. The third thing you're going to do is you're going to look at your P waves. When you're looking at these P waves, I want you to look at all the P waves in that strip. Are they all similar in appearance? And do I have a P wave before every QRS? And then the fourth step is you look at your PR interval. What you're looking for with your PR interval, you're making sure that it is constant, meaning your PR intervals are the same every time. And then you're also making sure that they're within normal range. The normal range for a PR interval is 0.12 to 0.20 seconds. So that is your normal range. So no more than 5 small boxes. And then the last step is you look at your QRSs. You're looking at duration, and you're also looking to make sure that your QRSs are all similar in appearance. They're within normal limits. So those are the things that you're looking for. So the first step is the heart rate, and that is what we're going to do right here. We're going to go ahead and talk about our heart rate. So remember how I told you in part 1 about everything is a 6-second strips, and you have some EKG papers that have hash marks. These, where my little arrow is, these are a great example of the hash marks. So instead of having to know 30 boxes and counting everything, you can go hash mark to hash mark. So from hash mark to hash mark, that's 3 seconds, and then I need another one, and that's another one. So that right there is a 6-second strip. So that is why we call this the 6-second strip method as far as calculating the heart rate. So what you're going to do is you're going to count the number of complete QRS complexes, and then you're going to multiply it by 10. So remember, a complete QRS complex, it has to have the Q, the R, and the S. And I know you think, well, yeah. However, sometimes over here at the end, where my little arrow is, you might have a QRS complex and it might be cut off in half. If you can't see the complete QRS complex, you can't count it in the rate. So we take the number of complete QRS complexes. So just for a refresher, let's talk about where everything is. Start over here. Okay, this is baseline. Everybody see baseline. And then what you're going to do is you're going to go, this is the beginning of your P. This is the end of your P. Here's your Q. Here's your R. Here's your S. It's coming back to baseline. That is your T. Okay, so we have one complete one right there. 2, 3, 4, 5. So I have 5 complete QRSs on this strip right here. I go 5 times 10 is 50. So my rate here is 50. So let's practice. Let me go through here and we'll practice another one. Okay, here's another one. Let's look right here. Let's go ahead and practice all of our parts. So this is baseline. This is P. Here's your Q, R, S, and then here's your T. Okay, so let's count the number of complete QRSs right here so that we can practice our getting our rates correct. 1, 2, 3, 4, 5, 6, 7. So we have 7 complete QRSs. And so that tells us that the rate right here is 7 times 10 is 70. That is what it is. Okay, so there's two great examples, and guys, now you know how to look at your rates. So that's one thing I want you to take some time and practice learning your rates. It's the first step in the 5-step method. Okay. So before we move on, I like to talk about some of the other steps. So after we determine what the rate is, then we want to see if it's regular or not. So to determine if something is regular or not, you measure the R to R. And so what I mean by that, when you look on this picture right here, remember this is your QRS complex. So this right here, this is your QRS complex. You measure from R to R. So I would measure from here to here, and to see if that was regular or not. And then once I got this, let's just say it's I'm just making up a number, okay? So just realize that, because I cannot count all those little boxes. I do not have my glasses on at this moment. But let's say this R to R right here is 30 little boxes, okay? We know it's not, but let's say it is. So then when I measure from this R to this R, it should be the same. It's consistently the same. That's what I mean by constant. So if the space between here was 30, then the space between here needs to be 30, and then the space between this R to R needs to be 30, and the space between that R to R needs to be 30. So that's what you're looking at when you are trying to determine if it is regular or irregular. The third step, remember, you're looking at your P waves. So here are our P waves right here. 1, 2, 3, 4, 5. And when you're looking at those P waves, remember the things you're looking for is you're making sure, do all my P waves look similar in appearance? And when you look at this one, you see that yes, my P waves are similar in appearance. And then do I have a P wave before every QRS complex? And as you can tell right here, here's a QRS complex, here's P wave, QRS complex, there's a P, QRS, there's a P, QRS, there's a P, QRS, and then there's your P. Okay. So that's what you're looking for when I say you analyze the P waves. The fourth thing we're going to look at is your PR interval. When you're looking at your PR interval, what you're looking for is, one, is it within normal range? So normal range is 0.12 to 0.20 seconds, okay? So no more than 5 small boxes. And so the other thing you're looking for is that your PRs are constant, meaning whatever this, let me get my little mouse here, whatever this PR is, well then this PR needs to be the same, and this one needs to be the same, and this one, and this one. So that's what you're measuring. And so let's look at this first one, okay? So remember your PR interval, you measure from the beginning of your P to the beginning of your QRS complex. So here is the beginning of my P, here's the beginning of my QRS complex. Okay? So that is what I'm measuring, and that right there should be no more than 5 small boxes. So that one is about 4.5 boxes. Okay? So then let's look right here. Here's the beginning of my P, beginning of my Q, about 4.5 boxes. Okay? Same thing here, and here, and here. So my PR interval is constant, and it is within defined limits, and that's what I'm looking for. The last step in the QRS, the last step is looking at your QRSs. One, you want to look at your QRSs and make sure that they are all similar in appearance, and as you can see, they are. And then what you're going to do is you're going to make sure that they're within normal limits. Okay, so no more than 3 small boxes and no less than 0.04. So when you look at these QRS complexes, they are within defined limits. So that is the 5-step method. Now, I know it seems very tedious, but to begin with, until you get really good at recognizing strips, that's what's going to help you build your confidence. That's what's going to make sure you're getting it right. So I do strongly urge you to use that 5-step method until you gain confidence in your skills and you know your rhythms. The first rhythm I want to talk about is normal sinus rhythm. I hope that this is what all of us are in, because this is what we should be in. If you were doing your 5-step method, this is what you would find. Your rate is going to be 60 to 100 beats per minute. Your rhythm is going to be regular. You will have 1 P before every QRS complex. Your PR interval, your PR interval will be within defined limits. Your QRSs will be within defined limits. So this is your 5-step method for normal sinus rhythm. We already did our rate up here. Okay, so this is already our rate. But let's analyze everything else. When you're looking right here, again, we did rate, so now we want to see if it's regular or not. So we would measure R to R. We would measure from this R to this R and compare it to this R to this one, from this one to this one, this one to this one, to this one, to this one. And what we would find is that they're consistently the same. So this is regular. And then what we're going to do is we're going to look at our P waves. Okay, when you look at your P waves, you see that all my P waves, and I'm using a little mouse and taking them to the P waves, are similar in appearance. Okay. And I do have 1 P wave before every QRS complex. That's something else you're going to look for. So my P waves are within defined limits. And then you look at your PR interval. As I told you before, when you're looking at your PR interval, you are just making sure that this PR interval is within defined limits. Okay? And as I look at this PR interval, it is within defined limits. And then the last thing you look at is your QRS complex right here. Okay? And again, you're looking to make sure they're within normal range and that your QRS complexes are they all look similar in appearance. This is normal sinus rhythm. We don't treat this. This is not significant because this is what a person should be in. This is the normal rhythm of the heart. So let's talk about sinus brady. In sinus brady, really the only thing that's wrong here is it's just slower than what it should be. Everything gets through, it's just slow. So let's do the 5-step method. The first thing you look at is your rate. Your rate is less than 60 beats a minute. The second thing you want to examine is your rhythm. Your rhythm is regular. What I mean by that is when you are looking at your R to R's, they are matching up and there's the same amount between them. Your P waves are similar in appearance and you have a P wave before every QRS complex. Your PR interval, it is within defined limits. And then you look at your QRS duration. When you look at your QRS duration right here, again, all your QRS complexes, they look similar in appearance. They are similar in appearance and they're within normal limits. So the only thing wrong right here is my rate. My rate is less than 60 beats a minute. And so then what you got to think about is, well, what's causing that? Okay? So take a few minutes right here and let's practice our rate. Calculating our rate, I should be. Remember, you take the normal of complete QRS complexes. Okay, you should have got 4. 4 times 10 is 40. So your rate is 40 right here. Okay, so the other thing you want to do is you want to determine if this is regular or irregular. I'm looking at my R's. This is a regular rhythm. Then let's look at our P waves. Do I have a P wave before every QRS, and are they similar in appearance? They are. And then look at your PR interval. Is your PR interval constant? Is it within normal limits? So when we look at this PR interval, what we notice is yes, it is. And then we look at our QRS complexes. Are they similar in appearance? And are they within normal range? They are. So by now, hopefully, you have determined that this is sinus Brady. So let's talk about sinus Brady. Realize that sinus Brady can sometimes just be normal for a person. Some people just do not have a heart rate that gets, I should say, that does not get above 60. And the reason that is because they have conditioned their heart so much that they don't consume as much oxygen as the normal population. So realize that for some people it's normal to be sinus Brady. Okay. Some other causes. One could be there's certain medical conditions that can cause it. Other things you need to be aware of. It can also happen when you are suctioning a patient, okay, or when they're bearing down like they're having a bowel movement. Any type of an MI could cause it. Hypothermia, if they have some type of heart disease, that can definitely cause sinus Brady or contribute to sinus Brady. So there's lots of things that can cause sinus Brady, but realize what happens is as long as their blood pressure is adequate, the person can tolerate a slower heartbeat. But if that blood pressure is not adequate, then what happens is the patient develops myocardial ischemia and infarction, or they could even develop heart failure. So those are some things you got to realize when you're taking care of someone who has sinus Brady. Some symptoms you're going to see. As we go through all these dysrhythmias, one thing you're going to see is that your signs and symptoms are going to be the same for a lot of these dysrhythmias, and you're going to get very frustrated. But I don't want you to be, because what I want you to think about is no matter what's causing it, this person has they're either a risk for or they have decreased cardiac output. It doesn't matter if it's caused by sinus tach or sinus Brady. So the symptoms of decreased cardiac output, they're going to be the same, guys. And so you have to realize that and not get frustrated as you go through this dysrhythmias and you're like, all these signs and symptoms, they're like the same. Of course, because they have decreased cardiac output. They're just caused by different things. So things you need to realize that they're going to have. A lot of times your person becomes very pale, very sweaty. They get very confused. Their blood pressure drops. And so what you're going to realize is you got to do something. You can't walk around with symptomatic sinus Brady. So what we try and do is we try and figure out, first off, what's causing this sinus Brady. Is it because you're an athlete? And typically the athletes that will have this type or will have sinus Brady, it's your ones that do endurance sports. For example, they're swimmers or they're runners or something where they have really built up their heart to where their heart does not need as much oxygen to be effective. If they don't have any symptoms, I'm not going to do anything for it. I'm just going to say you're good, your blood pressure's good, great job. Okay? I'm also going to look at what kind of medical conditions can this person have. I talked to you about some of them, but let me look at their drug list. Are they on any type of beta blockers, calcium channel blockers, DIG, morphine? Because these are all medications that can cause sinus Brady. So if it's because I gave a medication I shouldn't have given or the dose was too high, then I would contact my healthcare provider and act accordingly. But our primary intervention is we got to increase that heart rate. So what we're going to do, or what you're going to see in someone who has sinus Brady, is we're going to give them oxygen because we know they don't have enough circulating. Other things you'll see, we'll give them some atropine. And atropine, our goal is to increase their heart rate up to 60. That's our goal when we're giving the atropine. If we've decided that after assessing them, it's because they don't have a lot of volume, then let's replace some of their volume. And then if that doesn't work, what we can do is we can put them on an external pacemaker. So an external pacemaker, I'm sure a lot of y'all have seen it in clinical practice, but it is looks like a defibrillator, and it is a defibrillator to a certain extent. It could be used that way. Your defibrillators have lots of different functions, for lack of a better term. So what we do is we put the cardiac pads, we put one on the front and one on the back. I call it a heart sandwich. And your cardiologist will determine what he needs those settings to be at, or what she needs those settings to be at, to maintain adequate cardiac output for that individual. So they can be on an external pacemaker, but realize that an external pacemaker, it's not a long-term solution. An external pacemaker is just a short-term solution until we figure out what's going on with this patient. Did we cause it through medications, or is it caused because of a disease process that we can fix? So they're just on an external pacer long enough for us to figure out what's going on, or if it was medication, to reverse the effects of that medication. So that's what we do for sinus Brady. So remember, if they have absolutely nothing wrong with them, they are asymptomatic, we don't do anything for sinus Brady. Now let's move forward to sinus tach. So in sinus tach, the only thing that's wrong in sinus tach is that you have a heart rate that is greater than 100 beats per minute. That is the only thing that's going on in sinus tach. So when you do your 5-step method, your rate, like I said, it's going to be greater than 100 beats per minute. Your rhythm is going to be regular. When you analyze your P waves, what you will see is that you do have a P wave before every QRS, and they are similar in appearance. Your PR interval is within defined limits, and your QRS complex is less than 0.12 seconds. So the only thing that's wrong with this, guys, this heart rate is, look, it's just greater than 100 beats per minute. So let's do a rate real quick and see what this person's heart rate is. So remember, count the number of complete QRSs. I got 12. So 12 times 10 is 120. So this person's heart rate is too fast. So when you think about sinus tach, one thing you have to look at is, what is that person doing? As I told you right here, it is a normal response. Sometimes it depends. Is this person it's a normal response to activity? Is this person exercising? What's going on with this person? Are they trying to walk up some stairs? That's one of the first things we're going to look at there. So what you need to realize about sinus tach, let me go back here. Sinus tach initially enhances cardiac output. So please underline or circle initially, because I don't want you to get confused about this. So sinus tach initially enhances cardiac output and blood pressure. However, over time, that leads to a decrease in the ventricular filling time. And when that happens, it causes a decrease in cardiac output and in blood pressure. So sinus tach, it just increases the work of the heart. It does that by increasing the myocardial O2 demand. And the problem with sinus tach is it can ultimately lead to failure. So if this is not a normal response, if a person is just walking around in sinus tach, that's not a good thing, and we have to figure out why and treat it, because we know that ultimately that's not good for that individual. So things that we look at, when we look at causes, one of the main causes is caffeine. Okay, so the people that drink the Mountain Dews and the Mellow Yellows and the Red Bulls and the Rock Stars and all those good things that give us lots of energy, but it has lots of caffeine, and your body just does not know what to do with all that caffeine. So what happens is it causes sinus tach. So that's one thing we look at. We also look at smoking. Does this individual smoke or vape or whatever they might do? And when we talk about smoking, what we're looking at is the nicotine. The nicotine is a vasoconstrictor, and so it's going to constrict, making everything harder to go through, and it's going to raise the person's heart rate. We also look at some medical conditions, things that can cause sinus attack. You want to think they could have a fever. They could have pain, hemorrhage. Those all are medical conditions that can cause sinus attack, and so we need to make sure that we rule those out. Also, medications. Central nervous stimulants, they are a main culprit in causing sinus attack. Diet pills, okay? Thyroid medications, atropine, all those things can cause sinus attack. So we got to try and figure out what's causing this sinus attack. Or they could have had an MI and now have myocardial damage, and that's why this person's in sinus attack. So that's kind of what we do when we are trying to determine what is the cause of this. Things you're going to see. As I told you, it's a normal response to physical activity. But what you should see, if you think it's exercise related, as they sit down and get reacclimated, that heart rate should drop. Other things that you'll see an increase in sinus attack, I give you lots of reasons, or I give you lots of examples here, but realize it could be just because they have hyperthyroidism, they're scared, they have anxiety. Think about you before a test. Do you not have some anxiety, and does your heart rate not go up a little bit? It's very normal sometimes. So we got to kind of rule out what could be causing this. So depending on what the rate is, because remember, the lower the rate, the better tolerated when you're talking about sinus attack, but they could be asymptomatic, or they could have symptoms. So symptoms that you're going to see, they're going to be signs and symptoms of decreased cardiac output. Your patient's going to become very pale, they're going to have shortness of breath, they're going to become very weak, they're going to be very tired. There could even have some chest pain. And when you look at EKG, they can even have some T-wave inversion or some ST segment elevation. So, you just got to kind of assess them. Other things, they could have neck vein distension. They could have a decrease in their O2 sats. They typically become very restless, start having anxiety, and that's just due to the decreased blood flow to the head. Ultimately, they can also have some impaired urine output, and that's because they have impaired renal perfusion. So all these things right here are what you need to be looking for. So what do you do for sinus attack? Like I said, we try and figure out what's causing it, and if we can, we correct that. In the meantime, we give them oxygen because we know they don't have enough circulating oxygen. We'll also want them to rest. We want them to lay down, stop whatever they're doing. We can give them nitrates or morphine for the chest pain. And realize we like to give the nitrates because it actually dilates the vessels and it improves the blood flow. So that's one reason why we give nitrates. Morphine helps with the pain. The other great thing about morphine, and why we like to give it more than anything else for cardiac issues, is because it actually decreases myocardial's O2 demand. So it helps them out that way. If we think they have sinus attack because they don't have enough volume, then let's give them some volume replacement. If we think they have sinus attack because they have an infection, then let's treat the infection and let's give them something for Tylenol. If we can't figure out exactly what is causing it, and some people just they have sinus attack and we can't figure out an underlying cause. For those individuals, typically what they will do is they will be on a low dose beta blocker daily. And again, what this does, it just helps get that heart rate down. But remember, if you put someone on a beta blocker, you need to make sure that you check their heart rate and their pulse. So these are all things that we're going to do for sinus attack. So I always like to do a quick recap. So let's talk about normal sinus rhythm. Normal sinus rhythm, that is what hopefully everybody is in. That is a normal rhythm of your heart. When you are looking at these strips, remember, you want to do your 5-step method. Okay, normal sinus rhythm. That's what our heart irregular in. Let's talk about sinus brady. The only thing wrong in sinus brady is it's too slow. That is the only thing. Remember, in sinus brady, you're going to have a heart rate that's less than 60. Okay? And in sinus tach, it's too fast. So you're going to have a heart rate that's greater than 100 beats per minute. So those are things you need to realize there. But no matter if it's sinus tach or sinus brady, what you need to realize is if you don't get it under control or they start having signs and symptoms, the signs and symptoms they're going to have, it's decreased cardiac output. That's what you're going to see. And so your intervention should be geared towards improving that cardiac output.